You're busy, you've got a decent practice, but nobody wants to be decent. You want to be great, and you want to have a great practice. So how did the most productive, profitable dentist in the nation balance real life, work, and profits, and somehow make it all seem fun? Well, it comes down to simple, everyday practices. So grab a lunch, join us as we chat with top clinicians and influencers to discover their formula for uncommon success. Are you ready? Then it's time to explore everyday practices.
Welcome everybody to Everyday Practices. I am your co-host, Reagan Robertson, President and CMO of Productive Dentist Academy. We do not have our other co-host, Dr. Chad Johnson, today. As we are recording this, we are in the middle of the COVID-19 pandemic, and he is dealing with real practice stuff right now. He told me to tell everybody, go ahead and say that I'm doing spring break or I'm doing something fun, and then we giggled and said, nope. This is not, this is real world here, folks. And so that's what he's dealing with today. I'm really excited, as you guys hear me say every time, I'm really excited to meet our guest because I know you guys are going to get some juicy, good pearls out of this. On the horn today, we have Dr. Gwendolyn Buck. She is a general dentist from a rural area in Upper Michigan called Gwen. So I love it because we have Dr. Gwen in Gwen. If you look it up, Gwen, Michigan, I think it has, maybe 2,500 or so people there. You can do a neat little drone overview of this adorable town. It just is it looks like a lovely little place. Gwen enjoys traveling and eating. She's a foodie. She loves doing dental mission trips, and she loves her job. To give you guys kind of an example of what a PDA doctor really is, I think Gwen personifies this. She works 3 to 3.5 days a week. She's a solo practitioner in her small town, and she's been working with us since about 2011, the time that I started as well. She's, I think, a super producing doc, and she loves her schedule, and she feels that she's pretty consistent. So welcome, Gwen, to our show.
Thank you so much. Thanks for having me. I'm excited to be here.
Yeah. So during this pandemic, during this exceptional time that we are in right now, and being the doctor that you are, I know that you've had your share of lessons throughout, the past 9 years. You joined the same time that I joined PDA. Can you tell our listeners a little bit about, a little bit more about who you are and your journey so far?
Sure, I'd be glad to. I came back to practice near where I grew up. Although I went to a little bit of a smaller town outside of the 25,000 people town. So that gave me the opportunity to have a better dentist to population ratio. So that was nice. So I started out there in a small town. So it's got a nice little feel in terms of the way we know our patients, the way we watch them grow up and their families. So I started practice in 2008, and then I moved from the old building we were in to a new building in 2011, and 2010, and started with PDA in 2011. So it was really neat to have their help through my journey. They're one of the companies I recommend the most to my colleagues. So I'm excited to be here. Thanks for inviting me. When we started in 2011, I was producing probably about $500 an hour. And we were just ready for a change. We were getting really, really busy. And I heard about PDA, I think just online, something online, and just zero regrets in joining since. We've been over $1,000 an hour for a few years now. And it's just been a really neat thing to take my team through from that type of difference, but with the PDA philosophy of doing good while doing good. We don't have to compromise our integrity in anything that we're doing. So, it's been an awesome journey. I'm happy to say I love my job.
And you've worked with our consulting group, right? Is Christine your coach?
Yep. She's been coaching with me since the beginning. So over a decade now, or almost a decade, should I say. She's just been wonderful. And PDA has just been such a professional company. I'm just really glad that it exists.
Have you been able to zone in on your favorite service mix over the last decade?
I would say Yes, I do a lot of procedures, and I do like expanding them. Crowns are a great thing, and they're super fun. Most general dentists enjoy doing crowns, so do I.
Yes.
I also enjoy extractions, and I've taken several classes and learned several different bone grafting techniques too. So that's a really nice thing to offer patients. Making sure they've got the option to have a wider marginal ridge, even if they're getting a partial and not an implant, because that we know how hard a knife edge can be to support a partial denture. Whereas if you just have that bone grafted in the appropriate scenarios, then they get a chance for a much more functional and comfortable mouth.
So that's fantastic. I love that you've kind of honed in on the things that you love doing. I have a personal passion for extractions, even though I'm not a dentist. I just love all that stuff.
It's kind of a neat thing to do, and it's been fun too in just being able to not have to refer a patient when I do that. I enjoy that very much, that they can stay in our office.
Well, let's talk about that. So like I said, you live in a very rural community. How do you maintain your productivity? How are you attracting the type of patients that, need the type of care that you're so hungry to give?
Well, I think one of the things with in working with PDA is that sometimes I just had to trust the advice I was given and try it. And one of the PDA recommendations is to spend, I believe, between 5 and 8% of your gross on advertising.
Yes.
And so then you continue to get the new patient flow to get the restorative dentistry or extensive dentistry or whatever you're looking for in terms of things that are just outside your normal hygiene patients coming back. I think that's been a big, big help. And it's been fun trying to figure out marketing and advertising and figure out what works and what doesn't. And I love how PDA helps me track it too, because it is all about the numbers. It's some of it's just got to work. And if it doesn't work, hey, we tried it, and maybe it didn't cause any harm. We still got some exposure, but I'm willing, I guess, even though I'm a fairly conservative person by nature, I'm willing to take some risks, and that was kind of a big leap to spend that much on advertising. I think most dentists aren't used to it, should I say, to spending that much of their income on advertising.
No, I tend to hear that when they first come on our radar, they tend to spend around I think it's like 0.5%, maybe 1%.
Okay.
So it is definitely a mind shift. And then once their minds are shifted, it really kind of blows the top off. Do you have carry PPO and fee for service? What's your ratio there?
I'm lucky enough to at least of now not have to participate in PPOs. There might come a time when I'm forced to in my area, but right now I'm a Delta Premier provider and I'm not in PPOs. I'm participate in a couple insurances, but not PPO.
Nice. And I know that can make a difference too in how you spend and how you allocate marketing dollars.
Oh, I suppose it should, and who you target might be specific to the PPO in your marketing somehow, if you can. That makes sense.
So what are some of the fun? Okay, so give us a win and a loss. Tell us what was a marketing fail? You tried it didn't work, and then what was a win? And was either one of those surprising to you?
Sure. So I think one of the fails was radio. I've tried that a couple different times, and I think one of the things is that certain things are easier to track than others because, what's the real old research of, a person's got to see your advertising, 10 or 20 times before they're even going to take action or before they're even going to remember they saw it.
Yep.
So maybe it wasn't a complete fail, but radio did not prove to show an ROI when we asked patients, where did you hear about us? Mm-hmm. Maybe they're not going to list all 5 places they heard about us. But with TV, that has been a success. And we get a lot of exposure with our local TV station. And so that's been kind of fun working with commercial. All my other commercials have been only 30 seconds. Mm-hmm. So it's exciting. We just did the final editing and just trying to tweak it to just get a really professional result.
That's fantastic. And so do you pull outside of your radius? Are there any surrounding towns near Gwen with a larger population, or do you advertise mostly within your community?
Definitely within the county. So we've found that in my specific area, people are used to driving for services. They're, living in the middle of the woods and they got to drive somewhere to get milk or anything. Right. So people are willing to come from 20 minutes away, half hour away, sometimes 45 minutes away, depending on where they are and how close they are to other conveniences. There's a point when, if they're coming from 2 hours away, you gotta wonder, why, is that a red flag, or are they going to be committed to their appointments, or, but we do have a few patients that come from a few hours away too, and, have their reasons for doing that.
I know we have. When I did the over the shoulder at Dr. Baird's office, I think it was May of 2018, I want to say, and one of the patients that he had in his chair drove 5.5 hours just to see him.
Wow, that is something.
Yeah, so it could be, you'd ask what's kind of wrong or what's up with them, or it could be that they've heard of your quality.
It is a huge compliment, and we do definitely get those kind of compliments, and really are happy and proud to.
That's fantastic. So can you share with listeners, if you're comfortable, kind of what the pandemic has done to your community, and how has that impacted your practice?
So in Michigan, Monday, maybe it was March 13th, the governor, or the MDA, Michigan Dental Association, March 16th, the Michigan Dental Association recommended that dental offices not provide any care other than urgent or emergency care. Mm-hmm. And then that followed through with several other recommendations by the American Dental Association and the executive order from the governor. So it's not just recommendations, it's definitely law right now that we comply, which is understandable. Mm-hmm. So we've not been able to see any hygiene patients, although technically in the executive order by the governor, we can't see any patients for periodontal maintenance who are periodontally healthy. So in the foreseeable future, if this went on for many, many, many weeks, at a certain point, we would very likely start seeing periodontal maintenance patients, the ones that are high risk and that displayed inflammation in the past. Who knows when that'll be, or if we'll ever have to do that, but it's not currently being done. So no hygiene. We had to cancel my appointments for fillings and crowns and dentures and things like that. But we have been able to see some people, for instance, one of the other favorite things that I love to do and that I've started with is I've got over a decade experience in Invisalign, but I hadn't had a pretty limited experience with brackets. So we started 6 Month Smiles a couple of years ago.
Oh, nice.
We had a patient who, one of the things you're allowed to see a patient for is if they, have a wire poking them or something like that in orthodontics. Sure. So we've been able to see one of our patients for that. We've seen some extraction patients. I took out a nerve on a hot tooth on another patient. I, as a healthcare provider, I'm not going to walk away and send my patients to the emergency room. And although there's been sometimes we've prescribed antibiotics, there's also been cases where, a patient already had the antibiotics and is still swollen and the teeth just need to come out. So we've done that too. So we're trying to figure out, is there, especially if this goes on for a longer period of time, is there a way that we can have some sort of set hours, something like that? For instance, I was thinking maybe I could have my front desk come in on Monday, Tuesday, and Thursday mornings, answer phones. If there's emergencies, they're scheduling them for that same afternoon. And if needed, I go in. So just trying to kind of bounce around.
Nice. Right, to keep it going when it opens back up, because you're anticipating that need to increase.
Well, yeah, and just, I don't want patients to wait too long if they have an urgency, but also to give it some structure so that they might have an idea, I think I heard that they might see patients Monday, Tuesday, and Thursday afternoons. And if they need us, then, we're there. So we did send out a newsletter and Facebook post and Instagram post. It's nice to remind them that, hey, we're here for them. We're not encouraging, a bull rush of patients, but when they need us, I'm going to be there. I'm not going to not go to work. I'm happy to be a healthcare provider and to help in this kind of situation.
That's a fantastic segue, Gwen. I was going to ask you about how you're staying communicated to your community and your patients during this time. I've been seeing lots of creative ideas out there, and can you go over that again and kind of share, tactically, like what vehicles are you using? How are you communicating with patients and kind of keeping them in the loop with your status?
Sure. So PDA has helped get a notice up on my website, which is, just telling patients, well, it looks like right now we're closed as of up until April 13th, letting them know that. I did a video post, which was how we shared on Facebook and Instagram. And then since then, I don't necessarily want to focus all the way on COVID. Basically I've got zero excuses to not do a bunch of Instagram and Facebook videos right now. So I did a oral hygiene one with proxy brushes yesterday when I was at work, in between seeing a couple emergency patients, and then also, did another one on safe snacks to eat to prevent cavities to post in a couple days. So really, I've got no excuses to keep working on this. I feel like I've been a little bit lazy, honestly. I need to step it up even more.
No, I think I wouldn't call you lazy at all. I think it's fantastic. Our team just put together a beautiful white paper, and it was, blazoned across it is the worst thing you can do is stop communicating in this time. And so I think people are looking for, the tips and tricks to stay healthy until offices open again for elective care. So I think that's fantastic. What's your Instagram handle?
Northern Trails Dental Care.
Okay. Northern Trails Dental Care. And your Facebook, Is it the same thing?
Yes.
They can find your videos there?
Absolutely.
Oh my gosh, doctors, look it up and see if you're hungry for ideas. Definitely check it out. I think that sounds fantastic. Do you like anything funny? Do you ever do anything funny?
Oh, definitely. We're a pretty goofy office, so we love that. In fact, sometimes I think maybe I should post something a little more technical every once in a while, or there should be in there. We do
tooth in there somewhere.
Like that, but sometimes we have a little bit too much fun with it.
Oh, I heard one this morning, and this is for Chad since he's not with us today. Gwen, what kind of a doctor is Dr. Pepper?
Tell me.
A physician.
Oh, that's perfect. Oh, that's great. And in our newsletter that I had one of my team members send out, I said, make sure to put something in there too, like a dental joke. So, gosh, what did they put in there? I'll find it and tell you, but it was just so nice. It wasn't, just a serious thing. There's positive energy to be shared out there. And one of my other posts was going to be something like, isn't it funny how nowadays we can't really remember what day of the week it is? Just something silly like that.
Or for us who work from home, we go from daytime pajamas to nighttime pajamas.
Yes. Oh dear. Yep.
So Gwen, I know that this is, it's profoundly made an impact on everybody's practice. Obviously, that's not to be, overstated. Are there resources or areas that you're going to for good information, for trusted advisor information? What are you using personally from the business side of things to make sure that you're handling everything efficiently and making those big decisions?
It's coming from almost all angles. It's interesting. As it first happened, the first week, my mind was just, I felt like it was tangled wires up there trying to figure out, what do I do next? I know there's a lot of things I got to do, but what is it? Of course there's the local dental association, but also my colleagues, there's like a group of 4 dentists that have one of my friends and a couple of her dentist friends are just texting in a group chat and, hey, did you remember to, about this unemployment thing? And what about this? And do you guys think this is, a good way to handle that? Or, things like that.
Nice.
That's been helpful. I've, of course, relied a lot on my coach, Chris, and hopefully I haven't been too much of a burden, because I know all the coaches have got a lot on their plate right now. I think I maybe not had to have an incredible amount of support, but definitely relied on her. And I just wanted to make sure that even though I'm very interested in saving expenses at this point, that's not something I would drop right now. I need, and Chris, even if she doesn't have all the answers, she's got a lot of resources to help me get there. So the marketing team has been great in terms of a little bit of sharing what they've done for other doctors. And of course, we've got to, check and make sure it's applicable specifically in my state, because those doctors are likely in other states. But
right.
One of the things that they were talking about was just to give my patients a little bit more communication, to use something called Simplify. And it's a company that can help with a little chat button on my website.
Yes. Yes. We have a special for that right now, I think, actually.
Yeah. They said it was at least for, I'm not sure how long, but like free 60-day or free during the crisis, they'll set you up for that. So we're getting in the process of that. And what that is a patient might be on my website and it says, click to chat, like we see on some websites. Mm-hmm. And the Simplify group is a group of, people that have dental experiences. They're not my team having to take the call, but they have help guide. So we're going to guide them in terms of, forwarding, that information to us, making sure that we can respond in a timely manner. So I'm really excited about that.
I'm excited for you for that also. I hope that that's a great resource. Do you guys advertise online also?
We do. We've done pay-per-click, and it's still in my rural area. It's still up in the air whether the return on investment is going to be there. But we did switch that in terms of a little bit of an emergency message, in terms of not necessarily people expecting that they're going to get treatment for something. Right. If it's not an urgency. But that's been nice too, to have that as another avenue that people can hear. And I'm going to put out that 60-second commercial in April, and I'm not going to, there's one of the things Chris was telling me, my coach, was that she said, there's a lot of people watching TV right now. Yep. So you just get it out there and it'll be good. I have told myself several times, Gwen, you're not going to crawl into a hole, wish that this would pass. You're going to turn and face it. And we're going to work, and we're going to, deep clean the office. We're going to organize each operatory. We're going to post these videos. We're going to reorganize our front office manual, so that if it's just me and a clinical person, what do we do? So that's something that we've done too. So it's, I just want to face it head on. I want to make sure that I do my best as I look back on how I handled this.
You just dropped pearl after pearl right there.
Oh, good.
So Gwen, what you just described right there is how I have known your personality through Christine Ewan for the last 9 years. I feel that you have been through other challenges in your practice, and you've been in difficult, places of choice. And you have this grit about you that I don't know if it's part of your DNA. I don't know if it's, because it's optimism, but it's also like realism at the same time. So can you tell listeners again what it is that you're doing really quickly in this moment? Because as we're talking, my Apple notification just popped up and said the $2 trillion stimulus bill has passed. So people are at their computer, or on their TVs, watching everything as it comes out.
Yeah, I bet. Wow. Sure. So we're seeing, just emergency patients, but trying to figure out a structure. For instance, if this goes on for 8 weeks, can we have fairly normal half-day office hours, so we can still help some people with them kind of knowing some availability? We're working on Simplify, which is the online chat for our website, so people can have more connectivity to us. I'm going to call my phone company today, which I probably should have done last week. But anyway, I'm going to call my phone company to see if we can call forward if there's the case when we can't have somebody in the office, but still want to take those phone calls instead of making them go to voicemail. Let's see, posting on website, Instagram, Facebook, chatting with my colleagues. So yeah, just trying to keep up on things.
Wow.
What can we do in the office? What kind of projects can we do to make us better for when we return? Also,
do you think this is going to change the way you handle PPE in the future?
I expect that there are probably going to be some changes in the world that they're forever right now. Those changes from this pandemic are probably forever. I'm not sure what they are, but I think that I was talking with my emergency assistant the other day, and I said, well, from now on, we're likely going to have kids either wash their hands or use hand sanitizer before they go to that treasure chest, even though we are strengthening their immune system by having them just go in there without washing their hands.
Right.
That's also a good thing. But, from now on, that's something we might do. And in a way, it's really nice that we've already, since I've started, we've already been in universal precautions, assuming everybody has something infectious. So in terms of the clinical team, I think the clinical team is a lot more comfortable with it, whereas the front desk team, they're not necessarily in personal protective equipment. So I don't think that it's reasonable to expect front desk people to wear masks for eternity for the rest of their careers. So I'm not sure how that's going to change. We do have an open office, not a little sliding glass thing also. So there's not a way that we can very nicely modify it, nor do I want to. So do we have glass there? So it's going to be interesting.
Speaking of your team, how have you as a business owner and leader communicated this situation with your team?
It was verbal the first day that we found out it happened. And then it is somewhat individually in terms of, for instance, the hygienists right now have not necessarily shown that they're so interested in getting working hours that they want to come in and cover phones, or they want to come in and scrub floors, or they want, they're okay being at home with their kids. And, I believe, of course, many people are happy to just not be around people at this point too.
Right.
But I did want to make sure they all had the unemployment information because I wanted to make sure they started their benefits right away and didn't lose a week or 2 weeks or anything like that, especially if this goes on for longer than we anticipate.
There's a lightness in your voice around it. Was it when you had the conversations with the team, did you feel heavy? Was it difficult, or do you feel like you had a good understanding with the team and so it wasn't as difficult as perhaps it could have been?
I guess it wasn't necessarily incredibly difficult because in a way it wasn't really my call. It was a recommendation by the Michigan Dental Association. And even though that wasn't a law, it soon became a law that be abided by. There was definitely a sadness in terms of that's not what I wanted. In fact, on Monday, I showed up to work after knowing my colleague had already closed her office without any recommendations, saying, I said, this is how we're going to handle this coronavirus. We're going to continue disinfection. We're going to continue seeing patients. And then at 3:00 that day, okay, actually, no, we're not. So since then, I have 3 front desk people. One of them is a new patient coordinator who does assisting while she's seeing new patients, or helps us in emergencies if we're down an assistant. And she, so those 3 front desk might be in a group chat, although I try not to do that so often because then everybody gets dinged when one person answers. Texting's been good. My colleague set up a Zoom meeting with her team, which I think you can do both on Zoom or on WhatsApp. And there's lots of different options for how you can meet together with that. So I'm excited to hear how that goes for her. And we might just do some continuing education, or we might do, a meeting or something like that. So yeah, I guess that, that so far is how we've been communicating. I have meant to soon, within the next week or so, probably call each person and just check on them, see how they're doing financially, see how they're doing emotionally, see how they're doing, physically, and just see if there's a way that I can support them, in getting through this also. But I have not done that yet.
That's incredible leadership, Gwen. Incredible.
Thank you.
Well, let's switch gears a little bit and talk about yourself. What are there any books on your shelf that you've had time to pull out, dust off? Is there anything that's kind of tickling your fancy right now with regards to reading?
Yeah, I haven't gotten nearly as much reading as I should have during this time that I'm not working so much. But one of the books that's on my bookshelf is called Why We Sleep, which is, I believe, a bestseller. It's really been talked about a lot, by Matthew Walker. And I'm excited to be getting into the realm of sleep dentistry.
And, right on.
Of course, since a few years now, the American Dental Association has required that all dentists at least screen for sleep apnea. So we at least have to have a question on our questionnaire about snoring or sleep and things like that. So, but it's such an exciting field that I was excited to start to be a part of that. And it's a really, really respected field. It's exciting to, be a part of the medicine part of it and learn that aspect too. So that's been on my, that's dog-eared partway through. So I
think we had Dr. Meghna Dasani a few weeks ago as one of our guests. And I think that was the book that was on her shelf. And I don't know if you know Dr. Kent Smith out of Texas, Houston area.
I don't know him, but I've definitely heard the name in sleep dentistry.
Oh, he's such a fantastic character. What an incredible man. And he's been passionate about sleep for many, many, many years now. So it's really exciting for me to see other doctors, becoming more and more just excited about it and interested in it. And so that's a great recommendation. Why We Sleep by, did you say Matthew Walker?
You got it, Matthew Walker. Yeah, and that's exciting because it's, these are patients that I care about. I truly, it's not just a business transaction. I know the dentists listening, they understand. We care about these people that we are caring for. And if you can help them with something like this, when they've given up on their CPAP and, they've got, things to live for, it's great to be able to help somebody you already care about.
Yes. Absolutely. I don't think we've had any guest on that I could say doesn't care about their patients deeply.
Yes, I believe that.
Oh, all right, Gwen. Well, thank you so much for your time. I've got one more question for you, and I just want you to answer your gut response, okay?
All right.
Bacon or eggs?
Bacon. Oh, my goodness. Easy. I get it from my mother.
The bacon.
What's that?
What's your favorite way to eat the bacon?
Oh, that better be crispy. It better be crispy and give me the whole pound. I'm not sharing.
Ooh, I like it. Do you cook it in the oven or do you do it on like a griddle?
Oven if I can, definitely. Get the crispiest. Put it on a little wire rack and then put a pan below it. Oh, yeah, it's just wonderful. Yeah, and there better not be too many people over because I want all that for myself. And I'll just blame it on my mother. I get my lead foot and my love of bacon from my mother.
Your lead foot? I just pictured you speeding towards the bacon.
Yeah, probably.
All right. Woo-hoo. Well, thank you very much for being on our show today, Gwen. And take care. Well wishes for you, your practice, your team, your patients, everything as we get through this together.
Thank you. Thank you so much. Thanks for having me.
Bring your lunch or take us to the gym again next week to improve your everyday practices. Also, subscribe on iTunes, follow us on social media, and sign up for our email list. Now get out there and win with everyday practices.